And good morning, everyone. Thank you for attending. Hopefully, I can provide you with lots of information and clarify a lot of questions that will help you with your transition from the basic coverage onto the Medicare plan that you decide to enroll into. Okay. Go ahead, Mike. Next screen. Oh, that's an introduction. Okay, so few ideas. You've met Mike. Okay, Mike is our communications manager. I'm Ish Pena, Ismael Pena. They call me Ish. I'm the manager over the healthcare unit and RBU unit over here at Acera. And a special guest I have that's also going to be speaking on the part. We have Yolanda Smith, who is from Kaiser, and she will cover a few items that we want to have you be aware of. Okay. All right, so we're going to talk about the Medicare overview, a little bit about Acera and Acera's mandate, Medicare, how it works, and we're going to go over the Medicare plans, and then we can go ahead and hopefully have some time there to go ahead and answer any questions you may have. Okay, so basically, who is eligible for Medicare and who's involved? Normally, it's people 65 or older, under 65 if they have a disability, okay? And it's not a disability that's like an Acera disability retirement type of thing. Social Security has their own criteria as far as what they deem as disabled. Okay, so their criteria is going to be different than Acera's, and so if you meet the criteria that Social Security has as far as deeming you as disabled, then you may get your Medicare granted to you earlier than age 65, which is good because the Medicare plans are much lower in premiums. Okay. People any age, okay, with end-stage renal disease or ALS. Okay. Again, Social Security and Center for Medicare and Medicaid Services, CMS. So when you see those little acronyms, you'll know what they are. CMS. Okay. SSA. Right. Okay. So if you're currently receiving a Social Security check, okay. But they say that if you're currently receiving a Social Security check, they automatically enroll you into Medicare when you approach age 65. Okay, and that's all nice and dandy, but we still encourage anyone who's coming of age to be 65 to give Social Security a call, just to check in, just to make sure that they have the current information, your address and any contact information and any questions that they may have. They'll let you know, oh yes, we have everything that we have is current. We're going to go ahead and start to process your enrollment into Medicare. And it's always doesn't hurt to check in. Okay, but typically they will send you your Medicare card automatically. Okay, sometimes some members have gotten it a few months in advance. Some members get it the same month. It all depends on what the workload and what's going on over there with Medicare and where these cards are produced and sent out. Okay. So, but it is supposedly automatic. If you're not collecting a social Security check and you're waiting for an older age to get a bigger benefit, then yes, we encourage you to contact Social Security and let them know, say, hey, I'm going to be turning 65 pretty soon, and I'm going to need my Medicare A and B. Okay, that way they can go ahead and get you started with the process. Okay, now there is a time frame for this, and we'll be coming to that in the next few screens. Okay. Again, here we go. If you're not collecting a Social Security check, okay, you want to start the process at least 90 days prior to your 65th birthday. Okay, it's a 7-month window. So look at the month you turn 65 as the center portion. Okay, the center window. So 3 months before that, okay, and 3 months after. If you tried to start the process 91 days prior to the month in which you turn 65, they're going to tell you you have to call back the next day because you're too early. You're not within the 90 days. Okay. Then again, if you wait 3 months past the month of your 65th birthday, then you fall into a late enrollment penalty area. Okay, because it's the month you turn 65. 3 months before and 3 months after. That's a 7-month window. Okay, so you can't do it too early. You definitely don't want to do it too late because then you have to pay a penalty on top of the premium. Okay, so definitely contact Social Security Administration. Within 3 months from prior to your 65th birthday. Medicare is always granted the month of your birthday, and it's effective the first of the month of your 65th birthday month. Okay, unless your birthday falls on the first of the month, and then they bump it up a month prior. Okay. Next screen. So again, Sarah, we do have a mandate when you're dependent, when you and your dependent become Medicare eligible, which is usually at 65, in order to continue enrollment and receive the medical plan, be a recipient of the medical plan, you must complete the enrollment process into an ACERA-sponsored Medicare plan. Okay, so you would want to either transition over to our Kaiser Senior Advantage plan. If you do not want to get on the Kaiser Senior Advantage plan, then you'd want to contact via benefits to get into an individual Medicare plan that's nationwide. Okay, so those are your two options. You can't remain on the HMO. Okay. Okay, and here's one of the reasons why you do want to go on to a Medicare plan, because it will save you some money. Okay, so here we're going to use an example of a person who only has 17 years of service, because as you know, we subsidize towards the premium for the retiree member according to the years of service benefits. Okay, so but this person, 17 years of service, okay, they're turning 65, currently they're on their Kaiser HMO. Okay, that premium 810.72. Okay, with 17 years service, the MMA 15 to 19 years, we would pay $433.99. Okay, so this person's out of pocket every month, out of their monthly retirement benefit, is $376.73 to have that HMO. Okay, the same person becomes Medicare eligible, enrolls into our Kaiser Senior Advantage plan. Okay, that premium currently is $382.21. We're going to subsidize $382.21, leaving their out of pocket every month to have that plan at zero. So that means $376.73 gets to stay in their check. So their net amount or their deposit that they get will increase by that $376.73 because we won't be deducting that anymore. Okay, that's not too bad. All right. Next screen. Okay. What is Medicare Part A? Well, when you become Medicare eligible to enroll in Medicare coverage, it covers Part A. Part A provides hospital insurance. It takes care of the hospital parts. Okay, so skilled nursing facilities, rehabilitation, not long-term care, but it does take care of hospice care, home health care, some blood, inpatient hospital and care stuff. So those are the types of things it takes care of. Okay, and it goes ahead and takes care of items when you're in the Kaiser plan. Is taken care of behind the scenes. All you do is just go in and you pay your copay. Medicare billing and so forth is all handled behind the scenes because it's already assigned to Kaiser when you're enrolled into the plan. Okay. Okay. So again, enrolling in Medicare Part A. Okay. So for majority of us, Medicare Part A costs nothing because you or your spouse or your ex-spouse, you've married for 10 years, paid Medicare taxes while you're working and earned quarters toward the Medicare Part A. Okay, so basically, quarters 40 plus, Medicare Part A is free, no premium for Part A. Of course, if you have less, didn't meet all the quarters, then it starts to be a premium for the Part A. Okay, but a vast majority of us is already pretty much, basically, it's pretty much that you've hit the 40. For 2021, okay, some may pay at the $471 monthly just to have the Part A. Okay, if you don't get Part A for free, then yeah, they're going to try to charge you that $471. So you want to contact SSA, contact ACERA if SSA says that you need to pay for the Part A. Okay, but in most cases, if you choose to buy the Part A, you must also have Part B and pay the monthly premiums for both. Okay, if you don't, you could end up having a late enrollment penalty if you didn't sign up for them when you first became eligible, which is at age 65. Okay, so you may have to pay the higher premiums for twice the number of years you could have had had you not signed up for your Medicare eligibility as soon as you can. I see there's a question, Mike.
Let's see. Question.
Adelia Margie has her hand.
Ah, I see. Okay, you can unmute yourself and ask your question.
So, Mike, can you hear me now?
Yes,
Yes.
we can hear you.
Oh, good. So you may be answering this later, and I had to join a little late, so I apologize. My question is around, my husband is on my plan. I'm the Acera member,
Mhm.
and he's with me here now. And we'll be enrolling him in Medicare this morning or before his birthday, which is December 16th. So is it accurate to say that once he enrolls in Medicare, he comes off where he is now on the United Healthcare until we re-enroll him in either Kaiser or via benefits?
Yes. Okay. So let me. Yeah, I was going to get to that part a little bit later, but yes. So if you're on, so you're both on the United Healthcare plan
Yes.
right now. He's your dependent. He's going to become Medicare eligible.
Right.
So he will not be able to remain on the United Healthcare plan because it's not a Medicare plan. It's a non-Medicare plan.
Right.
So if he wants to try to retain a plan through that deals allow him to see his doctors that he has through the United Healthcare plan currently, he would need to contact via benefits and enroll and have them assist him to enroll into a plan that would allow him to still see those doctors. Okay, those are not, remember, those are individual plans on the via benefit side. So just like now, how the premium for him to be on your plan coverage is being deducted out of your monthly retirement check. Okay, through via benefits, those are individual plans. He would be responsible for paying the premium to that plan directly to have that coverage. Okay. If you're looking to come over to the Senior Advantage, yeah, he would need to. He can't just jump over to the Senior Advantage because he's not the primary member. You, as the primary member, would have to be enrolled in Kaiser to then be able to have him come over onto the KIPSA plan because you are the primary anchor. Because you are the primary member. So for him to be able to still see his doctors that he has through United Healthcare, he would need to go ahead and contact via benefits and have them assist him to get into a Medicare plan through them over there. And the plans over there, United Healthcare is a very large corporation. Okay, so a lot of these other plans through there, like Pacific Care, Secure Horizons, things like that, if whenever you get any mailing or anything like that, you'll see that in very small print right below their name or emblem, it'll say a United Healthcare division or whatever the case is. So the United Healthcare is still a United Healthcare plan. It's just one of the plans that United Healthcare administers and runs. Okay, they own that.
That's helpful. We've actually been reading up about it, and you answered my question. One of them that I would need to go over to Kaiser along with him, even though I don't qualify for Medicare just yet. What I'm wondering though, is there a gap in health insurance between the time where he's applied for Medicare and we're waiting to hear back, until when is he covered under United Healthcare before enrolling in either via benefits or Kaiser Senior Advantage?
Okay, so his coverage, his Medicare, his birthday falls in December, correct?
Correct.
Okay, what day of the month does it fall?
The 16th.
The 16th. Okay, so your Medicare would be effective the first of the month in which you turn 65. So your birthday is the 16th. So it would be December 1st is when you become Medicare eligible. So you would still have Kaiser, but you'd want to contact via benefits just be able to get into a Medicare plan so that, and you want to let them know December 1st is the effective date that you need that plan to be. So you would still have Kaiser you would still have United Healthcare through the month of November, and then as of December 1st hits, via benefits, they should have got you into a plan so that you have no gap. It just boom, just smooth transition right over into the next plan.
Thank you. That's
Okay.
very helpful.
You're quite welcome. You're quite welcome. Okay. All right. Let's see. Okay. Next screen, Mike. Okay. So what is Part B? Okay. Well, Part B provides the medical insurance portion of the Medicare. Okay. It helps to pay for approved doctor services, outpatient care, certain preventive care services. They do have this wellness checkup thing where they originally it was like a one-time. In the past was like boom, you get one shot at a wellness checkup and that was it. Now they've kind of over the years they've kind of expanded it, realized that it helps to make sure that people are well. So they've kind of expanded stuff so you get a wellness checkup when you contact your doctors and so forth. Okay, so let me fix this. Sorry, that's blocking my something right here. There. Okay. So again, for most Medicare eligible individuals, the monthly premium during 2021, the base amount is $148.50, which is the lowest standard premium for Medicare Part B. Okay, so some members may have to pay more depending upon their income, and I'm going to get to that in just a moment to kind of explain. The premium is usually deducted from one Social Security check. Otherwise, you're billed quarterly. So if you're not collecting a Social Security check, then what happens is Medicare will send you a bill quarterly. So they'll bill you for 3 months worth. Okay. So you got to make sure that that premium is paid to them because they will go ahead and disenroll you. They'll terminate your Medicare, which causes a rumble effect because what happens is, they terminate your Medicare. And as soon as they do that, they do a notification to whatever carrier you're working with to say, hey, we've terminated their Medicare. And that, or they, oh no, they lost their Medicare. Boom, they're not eligible for this plan. So you don't want to, there's a lot of stuff that happens. And you don't want to lose coverage and so forth, especially now during this pandemic stuff going on. You want to make sure you always have something, insurance that you're covered and kept safe. Okay. So again, there's many preventive care and supplies. So they do Medicare Part B covers quite a bit. Okay. Screen. Again, enrolling in Medicare Part A and B. Okay. Again, if you're not already collecting Social Security benefits, you want to make sure that you contact them. You can apply online. You can give them a call. It says you can visit office. With this stuff, I'm not sure. I think that they may have certain locations open. If you are looking to go into an office for Social Security, well, then you want to make sure you call ahead and make an appointment. It's from what I understand with members, it's better to have an appointment because then you only wait a few minutes, at least back when their offices were open. I can't confirm that they're open still at this time. But because otherwise it's like going to the DMV. No bad stuff against the DMV, but we all know that's like you need to take a whole vacation time to go take care of stuff at DMV. You'll sit there for a long time. Okay, so you can always fill out the application for enrollment for Medicare Part B. You want to submit it in person, you can at their office or mail it to your nearest office. So remember, completing the application form and submitting it does not automatically enroll you in Medicare Part B. Okay, Social Security must first review and deem that you are eligible, and then they'll go ahead and approve. Okay, so you got to keep an eye out for that one. Next screen. Here's that 7-month window that I have mentioned about. Okay, I'm sorry if I'm dark. My sensor goes out because it's behind a certain corner here. Okay, so again, it's a 7-month window. It's 3 months before your 65th birthday. Okay, which is and your Medicare is effective the first day of your birth month. Okay, unless you're born on the first, then they bump it up a month earlier. So your birth month, and then it says 2 to 3 months after, but it's 3 months after your birth month. Okay. Social Security enrollment period. If you miss the period, then they have another period where from January to March each year that they'll go ahead and allow you to try to enroll. Okay. But that coverage will become effective July 1st of that year. Okay. Then you're also looking at a lifetime 10% penalty for each 12-month period that you did not enroll in the Part B, and you should have. Okay. The exception are the working aged. Okay. So they may delay enrollment in Part B until retirement, and I'm going to be coming to what that is. Some people don't know what the working aged is, such as coverage under an active and working spouses plan. One may delay enrollment. In Part B, okay, you can retain credible coverage certificates from spouse's employer to provide later for enrollment and so forth. Okay. I'm going to talk about that in just a moment. Screen. Okay, here's, oh, one too many. There we go. Okay, so here's the working age. That if you're actually still working, okay, and you're on an employer plan, okay, because we do have some members who are still, they're not even retired, they're still working for the county, and they want to find out information. So here it is. So basically, what you can do is you become 65, you can delay your Part B enrollment, and that, okay, and use only your employer plan. If you're on the county's plan, if you're still working, you don't need to accept your Part B and start paying that Part B premium to Medicare, okay, because they're not going to cover it. You're on an employer plan, which is a very rich plan. So all they're going to do is say, well, we're not primary. That other plan needs to pay first. And of course, the county's plan is going to pay 100%. So you're giving premiums for Part B to Social Security or Medicare for nothing, because they're not going to cover anything because you're on an employer plan. Okay. So if Part A is free, you can go ahead and accept it and just have it. It's still not going to cover anything because your employer plan is going to be primary. But you can enroll in Part A and B and have both Medicare and your employer coverage. There's likely no benefit of that because, again, Medicare's not going to pay anything because they're going to say, well, that other plan is primary. So why give money away like that to them? Okay. You can reject the employer plan and enroll in Medicare and then supplement in other ways. That's something I wouldn't advise. If you're on an employer plan, typically those are very rich plans. Keep your employer plan as long as you can. Okay. And then finally, once you finally do decide to stop working and you retire, or if you're a dependent of a county employee and you're on an employer plan, or you're on your dependent's employer plan, once you lose coverage because they're going to stop working, then that's when you want to reach out to Social Security and say, hey, I'm going to lose my coverage now. I'm going to need my Medicare for me now. And then you can let them know the date that you're going to be losing that coverage. That way they can go and provide you with your Medicare. Okay. Okay. So here's how the premium item works. Okay. So what they do is they do a 2-year look back. So right now we're in 2021. So anyone is going to be enrolling in Medicare, they're going to look back at your 2019 tax return. Okay. And so what they're going to do is they're going to take a look at that and see what you claimed as far as your income. And then they're going to go ahead and apply that to the chart and apply that for your premium. Okay. So as you can see from the chart, if you file an individual tax return and you're 88,000 or less, then for 2021, it's $148.50 for your Part B premium. Filing joint, $176,000 or less, $148.50 for your premium. If you're higher up, let's say, for example, like where the third one is, single, applying your income is 111,000 up to 138,000, then your Part B premium is going to be $297. Okay, so you can see as the more income that you're reporting to the IRS on your tax return, the higher your Part B premium is going to be. They do review this every year. Okay, they do a 2-year look back. So like for 2022, they'll look at your 2020 tax return and so forth. So your Part B premium may go down, okay, or it may go back. It may go up if you're depending upon where you fall on the chart that they have for the new year. Okay, and it does happen sometimes. We do have members who there's a particular year that they may have taken some money out of an IRA or deferred comp lump sum to pay off some bills, or they may have received an inheritance, or they may have sold some property, and so for that particular tax year, it looked like, their income's way high, Okay, so you just reach out to Social Security and talk to them about it. And it's my income's not really that high. It was a one-time thing. This and this, an inheritance, this, whatever the case is. It's a lot. My income's actually a lot lower. And you can talk to them, check it with them. They may revise it down, or they may say, okay, well, we'll have to wait till for the next benefit year and then revise it. So, but you got to reach out to them. They're the ones that got to make that determination. Okay. Okay. Now, for the retiree member, sorry, dependents, this is only for the retiree members. Okay. So Sarah has a Medicare Part B reimbursement plan. Okay. We call it the MBRP. And so for 2021, okay, as long as you complete the MBRP reimbursement plan form, which is a real simple form, so name and address, you mark that you got Medicare Part B, you sign the form, you send it in. That's about as difficult as it gets. I'll send in a copy of your Medicare card that shows you have the Part B. And then what we do is on your monthly retirement benefit, okay, if you ever look at your statements, let me visualize it. Okay, so on the left side, top box, okay, that's where you usually see base amount. And then below that, you see your annual cost of COLA, right? The cost of living. Okay, you'll see a new line that says MBRP plan reimbursement, and you'll see 148.50. Okay, so we're going to give you 148.50. So basically, Medicare is taking 148.50 out of your pocket on their side, but here at Sarah, we're putting 148.50 in your pocket here. So it offsets. Okay, and again, if your income was higher and you're paying like that 249, you go ahead and pay that 249 to them for your Medicare, but in your retirement check here, we're going to give you 148.50 to help offset that. So then you're not all out that 249 if you're paying a higher premium. Okay, this amount is voted upon. I bring it before the board reviews it, they approve it, and so every year I've been able to get this to increase to the base amount, to match the base amount. So it's still too early yet to see what the new amount is going to be for 2022. We'll have to wait till Social Security and Medicare, they provide us what they decide on that. And then I'll take it to the board and have the board review for approval to hopefully we can go ahead and increase that. If it does increase, and we'll be trying to see if I can get this increase to match it. Okay. So this benefit, it doesn't matter if you are enrolled in an Sarah plan or enrolled somewhere else. Okay. So if you're enrolled under another agency somewhere else, another retirement, or if you're enrolled in a plan with your dependent, elsewhere, that's fine. This is a years of service benefit. It's not tied to a medical plan for Sarah. Okay. As long as you, the retiree, has 10 or more years of service credit, okay, or a service-connected disability, okay, and you provide us proof that you have the Part B and did this form, we will go ahead and still put in this 148.50 into your monthly benefit. You don't have to be into our, Kaiser Senior Advantage plan, okay, or Medicare plan to be benefits. It's a years of service benefit. It's not connected to that you have to be enrolled in the Sarah plan. Okay. All right. Again, this is not a retroactive benefit. Okay. So if you got your Medicare granted to you earlier this year, and now you're realizing that you didn't submit to get this reimbursement, you can't submit it now and say, hey, well, my Medicare is effective back in January. Can I get that retro back? We don't do. It's not retro. It's not a retroactive benefit. It's when we get the form and the proof that you have the Part B. So when we get the form and the copy of your card, boom, and then depending on it is when it's effective. Okay, so if you sent it to us now, but your Medicare is not effective to actually, January, we're not going to start giving you the 148 now. Okay, it'll start when it's supposed to be effective and when we get it. Okay. All right. Okay. Part D premiums by income. Okay. Again, the Part D does for prescriptions. Okay. And when you're on our Kaiser Senior Advantage plan with the Sarah, okay, the Part D is built into our KIPSA plan. KIPSA is the Kaiser Senior Advantage plan. Okay. It's already built in. So you're going to have the prescriptions taken care of. However, what Medicare has done is that if your income is over a certain dollar amount, they charge you this, what they call IRMA. It's called an IRMA. It's a income-related monthly adjustment. Okay. To me, I kind of look at it as like a penalty for having larger income. So basically, again, similar to the Part B premiums, if you take a look, okay, file individual 88,000 or less, or joint 176 or less, you don't have a premium. If you're above that 111,000 individual, or of 88,000 to 111, or joint 176 up to 222,000, okay, then they'll charge you $1,230 plus your plan premium. Okay, so it's kind of like being punished for having a larger income than normal. So they'll charge, and this is something that does have to get paid. You have to pay this IRMA to them if they send you this, because otherwise they'll take it as a declining of the premium of the coverage, and they'll go ahead and disenroll you from Medicare and disrupt your plan and all that sort of stuff. So we want to make sure that you don't have any lapse in coverage. So you want to make sure if you get this IRMA, make sure you pay that to them. But again, it's not that you're enrolling into a Part D plan with them, because if you're on our KIPSA plan, the KIPSA plan that we have, the Kaiser Advantage plan, already has Part D in it. This is just an adjustment, income adjustment that Medicare charges those that fall into a certain bracket for income. Okay. All right. Okay. Types of Medicare plans. Okay. There's thousands of Medicare plans out there, but there's two types that you want to know the difference between. Okay. So they're either a Medicare Advantage plan or they're a Medigap supplemental plan. Okay. Medicare Advantage plan, straight up. Medicare Advantage plan is similar to like an HMO, where you select your primary doctor, okay? And basically when you enroll into that plan, you're telling Medicare that, hey, this is my plan that I'm going to be going to and getting my Medicare medical stuff done. And so your Medicare is assigned to that carrier, okay? So if you had that and you went to your doctor and the doctor said, hey, you have to have this done, and you're like, whoa, you roll. I'm going to go see someone, get a second opinion somewhere else. And you went outside of your medical Medicare Advantage plan to get, a second opinion. Medicare is not going to cover that. Okay, that bill is going to be all yours. Okay, so you just have to work with your doctor and try to get another specialist or whatever to try and give you additional opinion. Typically, those Medicare Advantage plans, they also have Part D prescription plans benefit enrolled with it. Okay, you have an ID card and you have a set copay. Sometimes there's a deductible and so forth that you pay for office visits and prescriptions. Okay, they're also set by where you reside. Okay, so there are certain zip code areas where Medicare Advantage plans will take care of. You're in the eligible service area. Okay, if you happen to in this plan and you relocate somewhere else, you got to make sure you check in because you may have just moved out of the service area for that plan. Now you got to select another plan because you're going to lose that coverage. Now, the Medigap supplemental plans. Now those are different. Okay, your Medicare is not assigned to a specific carrier or medical group. Okay, you don't have to select a primary physician. Okay. So basically, you still have control of your Medicare. So Medicare, since it's nationwide throughout the United States, your coverage is nationwide. Okay, so you can go to any facility, you can go see any doctor, you can go see any specialist as long as they take Medicare, which the vast majority of them do. Okay, again, you don't have a primary physician, so if your current doctors now, you may want to just check in with them to see. Okay, do you guys accept Medicare? And they say, yeah, okay, boom, there you go. You can go ahead and select the Medigap plan, supplemental plan, and you'll still be able to see your physicians or specialists because they accept Medicare. Okay, again, this is nationwide. Okay, so your Medicare is the driver. So if you need to have a certain procedure done or something's going on, and you know that the specialist is over in another state, okay, you can call up, make that appointment, say, hey, do you accept Medicare? They say, yes, we accept Medicare. Boom, there you go. You don't have to get a referral to go to a specialist, okay, because your Medicare is what's primary. So you just got to make the appointment, make sure that they accept Medicare, and then you can go ahead and go see them and use your coverage. Okay. And then again, these are only medical. So you will need to sign up for a prescription D drug plan. So when you're going through via benefits and you sign up for a Medigap supplemental plan, they will also sign you up for a prescription drug plan so that your prescriptions are covered. Okay. Depending upon the plan you got, it's going to have co-pays. All plans are going to have co-pays, and there's some deductibles that may vary depending upon the plan that you select. Okay, because there's so many different variations of the plans. Okay. Again, if you're going to go through via benefits, they will go ahead and take all your information and your prescriptions. They have a great system that will pinpoint down a very, very good plans. Right now, we have close to 2,000 retirees nationwide that are enrolled in plans over there, and they're enrolled in over 246 different plans. That's how much these plans vary. There's so many different ones. So it's just a matter of talking to them and finding the one that you like best with your premiums. Okay. And again, the service area is in the United States is the service area. That's where Medicare covers. Okay. Okay. So these are the plans that Sarah offers. Just a heads up on it. Okay. So the non-Medicare plans, we have Kaiser HMO. We have United Healthcare Signature Value HMO. We have United Healthcare Signature Value Advantage. Okay. Now for Medicare, we have Kaiser Senior Advantage. If you don't want Kaiser Senior Advantage, then you would contact via benefits and they can assist you to enroll into a Medicare plan. Okay. Okay, so our Kaiser Senior Advantage plan. Okay. Again, typically you have to have parts A and B. Okay. It's only in California. We know that there are Kaisers in other states. Okay, so if you're in our Kaiser plan and you happen to relocate elsewhere to another state that has Kaiser, like Hawaii, Washington, Oregon, Georgia, Colorado. If you relocate somewhere else and you relocate in the Kaiser service over there, you would transition from our Kaiser and go on to Kaiser with them. Those are individual plans is what you would get. And once you enroll into an individual plan, Kaiser with them at that other state, then you'd want to reach out to via benefits regarding your health reimbursement account to get reimbursed for the premiums that you pay. Because these individual plans are not in a Sarah's system. So right now, the deduction you see on your monthly benefit, you see the deduction, you see the subsidy that we pay to. We don't do that for the outside plans. Okay, we're not set up for that. Okay. However, for 2021, here you can see the KIPSA plan by yourself, it's $382.21. Self plus one, if you both have Medicare, it's $764.42. Okay. And then there's the family rate. The co-pays on this plan is $10. Okay. And that is your copay. So you would just pay. So basically from right now, your copays are 15. Okay. So you're dropping down to 10. So you're saving $5 on just on that alone. In addition to the premium, because depending upon your service, we're going to cover the entire premium. Okay. Now, do you want to know if we do have a Part B only plan? Okay. So if for safety, this typically safety members may not have worked or paid into the system. And so when they turn 65 and they go to get their Medicare, they're told that, well, you have to have, you have to pay for Part A, okay? And this, of course, everybody pays for Part B, okay? But they can waive, if you're a safety member and you didn't pay in, or regardless, if you didn't work enough quarters, they're telling you need to pay for Part A, you can waive the Part A, okay? Just get the B, okay? And we can get you into our Kaiser Senior Advantage Part B only plan. Okay, if you're eligible to get to A and B, get A and B. But if you're telling you you're going to have to pay for Part A, waive the A, take the Part B. Okay, and we can still get you into the KIPSA plan and lower your premiums down to this amount. Okay, now there's a little something about this. If for whatever reason you decide to relocate outside of our service area, let's say you finally decide, oh, I'm going to go ahead and move to Hawaii or Miami or whatever the case is, okay? Our KIPSA plan is only here in California, So by relocating to another area, another state, whatever the case is, outside of the service area, you're going to lose this coverage. Remember, you selected to only have Part B. So you would need to contact Medicare, Social Security, in regards to your Part A, okay? Because on the individual side, those carriers and plans, they do require both A and B, okay? So you have to work with them as far as Social Security Administration regarding getting your Part A and whether or not, the penalty, there's going to be a penalty applied to it. Because if you didn't take them when you first became eligible, typically they add a penalty on top of the premium. But you can always check in to see with them whether or not, based on your spouse's eligibility, can you still be able to get it, free or with a minimal premium. Okay. Actually, can we go back one screen? Go back one screen. I want to let people know in regards to some new stuff that's coming up. So with the Senior Advantage, we've been working with Kaiser, and new for 2022. Okay, and this will be effective come February 1st, because that's when our plan year begins. We're going to have some new benefits coming up, and I'd like to have Yolanda. Yolanda, are you there?
Yes, I am. Thank
Okay.
you.
So Yolanda's going to tell you about some new benefits that we've now added in to our KIPSA coverage that members did not have access to before, but now they're going to have access to this.
Absolutely. So we're very excited to announce that we're going to be adding to your Senior Advantage plan for 2022, the Silver and Fit gym membership benefit, which will allow for you to have a free gym membership once you enroll in the Senior Advantage option. Some participating gyms are 24-hour fitness, In Shape, Curves, and in some YMCA locations are also participating. Now, if you have a gym that you're currently going to and are not aware that they are participating with the Silver and Fit benefit, you can contact ASH, which is our sponsor for the Silver and Fit benefit, that's American Specialty Healthcare, and see if they can establish a contract to include that gym in the Silver and Fit option. And some gyms do move into that realm to participate with them. The only gym that we have found so far that was not willing to participate in the Silver and Fit benefit was California Family Fitness. So that is the only gym so far that we have not been able to get to participate in offering Silver and Fit. But it has a slew of various gyms that are available to you, as well as for those who are not comfortable with, at this time, going into a gym, you can get an in-home kit also. So in addition to having the gym membership component available to you, you can also have a kit sent to your home that allows you to have in-home workouts. So there's such as chair workouts, yoga, Pilates, things of that nature that are available to you where you can do it in your own home, as well as they have some websites and some links where you can do in-home workouts with trainers as well. So this is a really nice benefit. It goes in line with the Kaiser Permanente model of trying to keep you healthy. Preventative care is the key, and we know that by accessing the gyms and having that as part of your everyday routine, it also keeps things like diabetes down, hypertension down, and et cetera. The other benefit that we're adding for the 2022 contract is a meals benefit. Now, this meals benefit is only applicable post-discharge for an inpatient stay at the hospital. It is a limited benefit, so it provides you with a total of 48 meals, 3 meals a day during that period post-discharge after an inpatient stay. So if you've had some type of surgery and you've been in the hospital, and as long as it's been approved by the physician, you will be allowed access to this benefit. It is not for outpatient surgeries. So if you have an outpatient procedure, which a lot of our procedures are done, this benefit is not applicable to that. Again, it is for after an inpatient stay at a facility. It is to help you recuperate at home and thus get you back on your feet. We found that many of the patients that once they go home, a lot of times we send them to a SNF. That's not a good idea. We want you to be comfortable. We want you to be able to be in your own home and in your own space where your recovery is a lot more smoother. And so by adding this benefit, we believe that it will help you to become healthier again and be back on your feet. So these are the two benefits that we're adding as of February 2022, and we hope that you'll take advantage of these benefits that will be available to you as a Senior Advantage member. And Ish, I thank you for this time. If there are any questions, please let me know.
Thank you, Yolanda. Thank you. Oh, we got a question.
Actually, hi, it's actually, I don't think it's for Yolanda, but thank you for that explanation. It's more about if we enroll in Kaiser Senior Advantage, we've been on United Healthcare, and we try it for a year, we have the option of going back to via benefits at the new enrollment period. Is that correct?
Yeah. During open enrollment every
Absolutely.
year, yes, you can switch over to a different
Okay.
plan.
Okay, good. Thank you.
All right. Well, thank you, Yolanda. That was great. More information regarding the new benefits, we're going to have that in our open enrollment guide when that comes out. You should receive that probably around mid-October. The new guides for 2022 will be going out with our open enrollment packets, and so you can watch for information on that. There'll also be some links and so forth that you can click on and access to read more information or find out more about it. So we're going to be trying to get as much information about the new benefits out as much as possible out. So just keep an eye out for it. Okay. All right. Thank you. Thank you. All right. So here we're coming to the via benefits portion. Okay. So plans through via benefits to the Medicare exchange through via benefits are not an ACERA group plan. Okay. Those are individual plans. Okay. And will not appear on your monthly statement. Now, we've already mentioned that before, okay? So the member and dependents are solely responsible to pay any premiums to those carriers to maintain that coverage. ACERA is not going to be doing deduction and issuing the payment to those carriers, okay? So members who are eligible for ACERA's monthly medical allowance will be granted a healthcare reimbursement account for their medical out-of-pocket expenses up to the qualified amount, okay? The HRA account, health reimbursement account, is only for the retiree member. So if you have a dependent who has out-of-pocket costs, you can't submit for reimbursement of those costs to the HRA. The HRA is only for you, the retiree member. Okay. Again, it's for any out-of-pocket expenses for dependents are not reimbursed. Only items for the member. This health reimbursement account, once you enroll into a Medicare plan, or to a plan through via benefits, you'll be able to speak with the representative there, and they'll be able to try to set you up for your health reimbursement account. You can have this the reimbursements done with direct deposit back to your account. You can, which is what we recommend, because trying to depend on the mail service and a hard check being mailed to you, you never know. There's a lot of mail thefts. People break into your mailbox. Sometimes things get delayed. Bad weather's coming. I'm pretty sure later this year. So deliveries in some areas may be slowed down, if not stopped temporarily. So you, at least with direct deposit, boom, the money reimbursement gets right back into your account. Okay. Same thing with the carrier you select to enroll with. You can have them do an automatic deduction. So they'll pull your premium. They turn around and report to via benefits, hey, we received this person's premium in the amount of such and such. Then via benefits checks the HRA. Oh yes, they have a balance. Boom, they turn around and issue you your reimbursement. Okay, so you can set up for auto pay, auto reimbursement, reoccurring premium reimbursement. There's a lot of things you can set up with via benefits to make sure that you get back your monies regarding the out-of-pocket items. Okay. Next screen.
Ish,
Yes.
we have a question up on the board. So you actually raised your hand, but and type in a question, but I'll just go ahead and read the question. And if you want to add to it, I'll just allow you to unmute if you want. The question is, if you are visiting out of state and become ill, what is the protocol? If Kaiser is not available in that state, what do you do?
Okay. Okay. Well, all plans have emergency services. Okay. So if you are on our Kaiser plan and you're out visiting in another state somewhere and you become sick, you'd want to go ahead and seek medical attention. Okay. It is only for emergency services. Okay. So if you're in another state, you can't go in for a wellness checkup or get a flu shot or whatever the case is. It's for emergency services. So if something happens, you become sick or injured, go ahead and seek care, right away. And you want to make sure you let them know that, hey, you're a Kaiser member, and on the Kaiser card, it has a number. They can go ahead and contact Kaiser to kind of discuss the items. You can give Kaiser a call, so let them know, hey, I've been injured, I'm sick, I'm going to the emergency room, this, I'm over here. This is where I'm at, and they'll be able to go ahead and assist with that. So basically, you'll be taken care of at the facility or wherever you are, okay? And then Kaiser works to try to coordinate as far as what kind of billing. So how Kaiser handles the billing, or how the other facility handles the billing of your services, that I don't totally have all privy to because of HIPAA information, but it does have emergency services wherever you go. So if you're traveling and you're on any plan, there are emergency services, but you got to remember, it's emergency services, not that you can just go in for a regular checkup and so forth. Okay. Here, something happened to my screen. Okay. Okay. So Mike, I can't see the. Let me switch back. Oh, here it is. Okay.
You got it?
I got it. Thanks. I fixed it. Okay. So again, via benefits enrollment, they don't have an office that you could just walk into. Okay. So it's all done through a phone interview. So you would go ahead and give them a call. We would provide you the information. Okay. And you can go ahead and give them a call. Make sure you have all your prescriptions with you, the names and so forth of your doctors, the facilities you go to, and they'll be able to enter your information in and see where you reside and provide you with what plans are available to you where you are. And then you can go ahead and discuss the plan and then make a selection, and they can go ahead and assist you to get enrolled into that plan. Okay. Again, plans are nationwide. Okay. Reimbursement available for retirees out-of-pocket expenses, including your drug. That goes for your premiums. It goes for your drug pharmacy costs. Any deductibles, things like that. If you're paying out of pocket, you want to make sure you get your receipt and so forth, so that you can provide for reimbursement. Okay. Again, auto pay. There's direct deposit. Any items that you have out of pocket, any claim items that's this current year. Okay. So for example, the HRA is from January 1st. The benefit year via benefits, those individual plans, runs calendar. So it's January 1st through December 31st. Okay, so you have all 12 months to utilize the HRA allocation that we provide to you. Okay, so let's say now we're now in January or February. Okay, because come December 31st, and once January 1st hits, whatever balance you have in your HRA account is going to get wiped out to zero because you start a new year over again. Okay. So let's say we're in February and you come across something on your desk. Oh, I bought this prescription in December. Okay. So because as long as it shows that it was in this year, 2021, you could still submit that claim in, okay, and get reimbursed for that as long as you still had a balance for 2021. You can still get your out-of-pocket 2021 items reimbursed to you. And you have until March 31st to utilize any of those claims for the prior year. Okay. Otherwise, it's a done deal. So even though you had a balance in December 31st, January 1st comes, we wiped out your balance to zero because now we're starting 2022 year. You find any items that that were 2021 that you didn't get to submit for, you have until March 31st to submit for those against the whatever balance you had still for 2021. Okay. Via Benefits, they also have a website. So, you can submit things online. You can create your login for their website and access to your account. You can view your balance. You can see what items are pending of your claims. You're able to get a form and submit for reimbursement. All these items things you're able to do. One of the items that I really like is that it finally switched to it was you no longer have to put your social security number and address and other stuff onto the claim forms. Because members were submitting claim forms that had address, social security number, and if they're mailing it to the wrong place or they're faxing it the wrong place, and now your information is out there. So what Via Benefits has done, I've been pushing and pushing. They finally put in like a little scanner box thing. You may have seen these little codes, right? It's a little code, and when you scan it, it provides you information. So their claim forms are now designated with the little scan bar thing that identifies you. So you don't have to put your social security number on there, okay? Which is helpful for protecting your identity. Okay, so which is a good thing. So they got some pretty good items with their website. You're able, like I said, you're able to submit things online if you wanted to do that too. Okay. Next screen. Okay. The prescription profile. I've been watching for several years since we've got their benefits enrolled with our members. So during open enrollment on the Via Benefits side, the individual side, open enrollment begins October 15th for the Medicare grouping. Okay, so October 15th all the way through December 7th. Okay, you have until December 7th to make a selection to enroll into a plan over there, and their plans become effective January 1st. Okay, Sarah's plans become effective February 1st. Via Benefits January 1st. Okay, so you start earlier over there because those are individual plans. So for the vast majority of members, once they get into a plan, they find a plan they like, they're set. Okay, so but I always recommend that they check with their with Via Benefits regarding the prescriptions, because since the pharmaceutical companies keep creating things and shifting things from one tier to another, it's changing the cost of these medications, right? So every year they're doing major changes to this. So I always recommend to members, even if you like your plan, that's great, but check in with Via Benefits and have them run your prescriptions through their profile. What it does is you let them know your prescriptions, they enter it in, and what it's going to do is it's going to take a look at your plan that you have now for your prescriptions, the costs and co-pays and so forth, and it's going to compare it to anything new that's now out there and show it. So then they could tell you right off, okay, well, you got a good plan, it's probably best for you to go ahead and keep it. Or there's another plan that's going to cover your same prescriptions at a lower premium and a lower cost. Okay, so then you can make the decision. Okay, well, move me over to that one. Okay, so there's a good thing about the prescription profile that they can set you up for to help you with. So vast majority of members, they do in October, they'll go ahead and call up and check on that just to make sure that they're able to get a good cost and premium for their prescriptions. Okay, so that's pretty much the main thing that they're doing nowadays. Okay. Next screen. All right. Again, open enrollment. Okay, with the Sarah, our open enrollment period is November. Okay, so November 1st to November 30th, and our plans for our Sarah plans become effective. Any changes and so forth become effective February 1st. If you're going through Via Benefits, that open enrollment occurs October 15th and runs to the 7th for the Medicare groupings, and those become effective January 1st. Okay. All right. Again, any plan that you select with the Sarah, your monthly benefit has to be enough to be able to deduct that premium. Okay, you can't select a plan that the premium is more than what we're paying you. You can't select that. Okay. Okay, so here just to show you real quick on how these have been going. Okay, so here, the top section where you see the blue, okay, these are the MMAs that we've been paying for 19, 20, and 21. Okay, so you see for 2021, the MMA stayed the same based on your years of service. Okay, so we would pay up to that amount of towards a premium of an ACERA plan. Okay, now if you have an HRA, if you're moving over to via benefits, okay, and you're not Medicare, then that's your amount that you'd be eligible for, your monthly HRA amount that you can get reimbursed up to. Okay, now for the Medicare exchange, when you move over to via benefits and you have Medicare, then your allotment for your HRA amounts are right there below. See, for 2021, 20 plus year members, 443.28, 15 to 19, 332.46, and 10 to 15 is 221.64. Anything under 10, you're not eligible for anything. Now the good thing is the board did pass and approve for 2022. These amounts are increasing. Okay, I didn't update this chart because you're still going to be in the 2021 year, but in your open enrollment guidebook, it will show what the amounts are going to be for 2022, and I can tell you that right now. So basically, for 2022, the 20-year plus, the 578, that's going to increase to 596.73. Okay, the 433.99, that's going to increase to 447.55. And then the 289 is going to increase to 298.37. Okay. Now, so in regards to the other one, so that the charts and so forth will be inside your open enrollment guide. Okay. And just the FYI, so remember I had mentioned how the Kaiser Senior Advantage plan earlier in the screens was currently 382. For 2022, the premium actually has gone down. Okay, so for 2022, the Kaiser Senior Advantage plan is only going to be 346.19, and that is the premium with the brand new benefits of that were spoken of with Yolanda. So with the gym membership and the meal rider included, the premium is going down, and it's only going to be $346.19 for the Kaiser Senior Advantage in 2022. Okay, so that's a really good deal. Next slide, Mike.
Oh, you didn't see my question.
So qualifying events. Okay, people always ask, well, when can I change? Okay, well, qualifying events. Loss of coverage is a qualifying event. It allows you to make a change and select a different plan. Relocating out of the service area. If you relocate out of the service area of your plan, of course, you're going to lose the coverage. So we need to get you transitioned over to a different plan. Of course, we have our annual open enrollment. Of course, becoming Medicare eligible, okay, is also a qualifying event, okay, because now that you're getting your Medicare, it allows you to select a different plan, okay. Retiring after age 66, marriage, okay. If you get married again, or you got married, okay, then you got 30 days to add the new spouse onto the plan with it, okay. Of course, a new domestic partnership also, yeah. All of these items is you have a 30-day window to reach out to us and help get you situated with a different plan, okay. So these are qualifying events. Again, moving out of the service area, most retirees, once we activate direct deposit and the money's going into the account, they drop off the radar. We don't hear from them, So, but it's very important that you at least keep us updated with your address, okay? It's really critical because you never know if you may have relocated out of the service area of your plan. Or what if something occurred and, we terminated the contract like several years ago when we got changed the contract with, was it HealthNet that we got rid of? There was another time we had Blue Cross, we got rid of Blue Cross. What if the contract is terminated and we got to try to reach out to you? We're trying to send you information. Hey, you need to select a different plan, and we have a wrong address. Okay, so you can always complete this online, or complete a form, and a ACERA form, download it and send it in, or go into web member services and process it that way online to the input. Okay, so it's very important to always keep us updated as far as your current address and so forth. All right, you can go onto our website and download any forms or create your membership login through our web member services on our website. And in there, you can just complete things online. Okay, very important. Okay, so, all right. So this brings us to conclusion. You can email us any questions at acerainfo.org. Our agents are always ready there to respond. They'll do research, take a look and see what you got, what's your question, and provide you back with forms or information that you need. We're always ready to help you. Okay. Thanks for viewing and have a great day.